Hi everyone, thank you for joining. My name is Alex Lopez. I am a licensed radiologic technologist, which is just a fancy way of saying I'm an x-ray tech. So today we're just going to be briefly going over the differences between sex, gender, and the new approaches to gender-based care in the medical field. So what is the difference between sex and gender? A lot of times those terms get used interchangeably, but they are different. So sex differences are based on biological factors such as reproductive function, hormones, and anatomical differences, whereas gender is a behavior-based role, such as the expected role one plays in a cultural society. So years ago in the US, it was normal or expected for a woman to stay home, raise babies, and just take care of the house, whereas the husband would go to work and be the breadwinner and essentially support the family. But lately in the United States, we're kind of redefining these gender roles. It's not uncommon for the woman to be the breadwinner and the man to stay home and support kids. If you're wondering what category like a transgender patient would fall into, it's important to keep in mind that sexual identity is different than biological sex. So just because someone identifies themselves as the opposite sex than they were born with, it's still important for us to know their biological sex for several reasons. One main reason is that a lot of transgender patients still have some of the reproductive organs that they were born with. So, for instance, a biological man that identifies as a woman is probably still going to have a prostate. So routine prostate screenings are going to be necessary. Just like a biological woman that identifies as male, if there's still a cervix present, they're going to need cervical screenings to prevent cervical cancer. So we just need to keep things like that in mind. But there are many biological and behavioral differences between men and women as well. So men tend to engage in more dominant risk-taking behavior because it's more masculine, and women don't tend to take part in some of those risky behaviors as much because, you know, we're raised to be feminine, and often we're just more sociable and friendly than men are raised to be. And then I do want to read the statement from the National Center of Biotechnology. So it says there are several important physiological differences that have critical implications, including the susceptibility to different diseases and the ability to metabolize different medications. What does that mean? It pretty much means that the sex you're born, you're going to have certain biological and medical factors associated with that. So women are twice as likely to suffer from depression as men, whereas men are more likely to suffer from schizophrenia than women. Not to mention they metabolize drugs at different rates. So what happens when someone experiences either a lack of gender-based prevention or negative care? Most commonly, their mental health is going to be affected, and it's going to discourage them from seeking medical care in the future. There's already enough stigma and discrimination against the transgender community, and us as medical professionals, we don't need to contribute to that at all. There's studies that are showing that over 41% of transgender patients have attempted suicide at one point in their life. So it's really important for us to actually be caring and kind to our patients. Because the ultimate goal is going to be to provide quality care so that they want to return. Because unfortunately, in the transgender community, there's a large number of people that will seek non-medical medical care. So essentially they're going to untrained people for medical care. And this can be anything from hormone therapy to silicone injections. Um, Besides the fact that these are risky, they're being done by untrained people that have no medical background. Some of these procedures can severely injure or kill someone. They're actually referred to as underground procedures. So like I mentioned, our goal is to provide quality care for them where they don't feel they need to go out and, get work done in the back alley. They need to feel comfortable enough to come into a facility to have quality care done. So how does that relate to caring for transgender patients? So it's not uncommon for transgender patients to present themselves as the way they identify in order to avoid discrimination. So as healthcare professionals, we need to know how to respectfully talk to our patients to be able to get the information that we need to provide quality care without discriminating against them. So the most important thing we can do is create a welcome environment for transgender people, well, for all people, and address patients using their preferred names or pronouns. And this can go for anybody. There are still, some people that like to be called, Mr. Smith over their first name. And it's just courtesy that we need to, provide to these patients. So I did find some really great information from the University of Iowa Healthcare, and they actually developed a quick tip to provide care to transgender patients. So I'm going to go ahead and read that to you right now. It's called the TransCare Approach. So treat transgender individuals with respect as you would for all of your patients. Refer to transgender people by the name and pronoun associated with their gender identity. We kind of just talked about that. Ask politely how they wish to be addressed if you are unsure about a patient's gender identity. Never reveal a person's transgender status unless it is absolutely necessary for the patient's health care. Excuse me, got a little bit dry there. I can't stress that one enough. There is no reason if you have a transgender patient that you need to go tell your coworker that you have a transgender patient. It's not necessary. Unless it absolutely affects their care, you don't need to discuss that. So following up with that is set a high standard of inclusive care. Concentrate on care, not curiosity. So for example, it is inappropriate to ask about genital status if it's unrelated to care. So for example, if you're a dental assistant, you don't need to know your patient's gender identity. You don't need to know. I used to be a dental assistant, so I can vouch that that has never come into play for caring for a patient. Avoid negative facial reactions and offensive language. Remember that treating a transgender patient is not always a training opportunity. Don't ask them 50 questions. And finally, educate yourself and others about transgender healthcare and issues, which if you're watching this video, you're already starting to. But if you have questions about transgender patients, we have this amazing thing called the internet and Google. Google real quick and you'll have endless amount of information at your fingertips. You don't need to ask a patient unless they're, for whatever reason, wanting to tell you about transgender. So, and then over the years, there have been new approaches to gender-based care. And one of those advancements is training medical personnel, which is kind of what we're talking about right now. It's just ways to treat people. Another advancement has been the development of new medications. So historically, at least in the United States, it was routine for only men to test new medications in clinical drug trials. And it wasn't until 1993 that women became included in the drug trials in the United States. That's pretty alarming, since I had kind of mentioned before that men and women metabolize drugs differently. And women are twice as likely to suffer from adverse drug reactions than men are. So the fact that they're finally including women in these clinical trials is actually a pretty good advancement for gender-based care. Um, and another approach that's becoming more common is the patient intake forms. So undersex having more than two options. So it's pretty routine now to have male, female, or you can check other, or sometimes there'll be a blank space where someone can fill in the blank. And then another area on the patient intake forms is name preference. So I appreciate that. I don't go by my legal name. So, nobody calls me Alexandra. I only go by Alex. So I'm sure there's a lot of patients that can appreciate that. So, just keep in mind the easiest way to treat transgender patients is with kindness and respect. Treat them the way you'd want to be treated or you would want somebody in your family treated. If you do want any additional resources, the University of Iowa Healthcare, the Trans Approach is a great resource, as well as the Center for Disease Control and Prevention. They have some great information on patient-centered care, specifically caring for transgender patients. And like I mentioned earlier, Google it if you have a question. You will have an abundant amount of resources at your fingertips. Thank you all for watching, and I hope you all have a great day.